I would like to welcome all the audience for Aspire podcast. Okay, so today we are very delighted to have Professor Atsushi Tanaka, who is the director of St. Mother Hospital located in Kitakyushu City in Japan, and he also is a visiting professor of Juntendo University, Department of Obstetrics and Gynecology in Tokyo. He has reported the first successful gift in Japan in 1985. He has very interesting background. Okay, he has board certified in many aspects in cytodiagnosis, in OBGYN, in reproductive genetics, and also in reproductive medicine. And for sure, he also is a certified board certified anesthesiologist as well. That is why he is the most suitable person who will give a podcast today on the topic of what anesthesia during ovum pickup. I would like to welcome Professor Tanaka. Hello, hi, Professor
Hi.
Tanaka. How are you?
Thank you very much for kind introduction. So today's topic is very important, and many people, audience, are interested in this area. So at first, I would like to touch about a little about the Japan's current condition. As you know, Japan has the largest number of ART in the world per couple, but the success rate is very low because the patient average age is 60, very old. So Japan's about over 56% of oocyte pickup is fully without anesthesia. So they use only one natural ovulation egg and with chromophin, 2 or 3, very small number of eggs. So anesthesia for oocyte pickup is not so concerned for them. But I think it's very important for the patient to get a higher success rate with one cycle, with one trial. The accurate success rate should be increased. So I'd like to talk about global point of view. So this point, okay?
Yeah, it's very interesting. It is kind of very unique to hear that most of the cases for the oocyte pickup are done without anesthesia. So let me ask the first question: what are the concerns? Why do they prefer to do it without anesthesia?
Yes, so most people who desire IVF are healthy. But some patient with some kind of diseases requiring treatment can also do the egg retrieval with anesthesia because they are well controlled. So I will show you our anesthesia scenario, okay? This is very simple, and we have been doing this method since 20 years, and we have no problems with this method. So it's combination of sedatives and anesthetics. So first, anesthetics is pentoxicin, 6 milligram, and then if the operations longer and if the patient move during the oocyte pickup slightly, 50 milligram one shot at. Then after sedative propofol as start, okay? First 40 milligram, and then twice 20 milligram, twice separately, and after It's uh, with a continuous infusion via a 30 milliliter syringe pump. So this is our method. So with this method, we have so annually five or 6,000 cycles per year, but we haven't ever no big accidents. So because it might be this procedure is, I think it's completely established due to the technology. So also pickups the doctor's skill and also the anesthesiologist and the nurses. Nurses is playing a very pivotal role. So monitor the patient. So nurses so have a not licensed system in Japan, but they have a deep knowledge about to monitor the patient. So before and after the operation, the monitoring system is very important. And there 90% of a patient is okay, but the remaining 10% have high risk diseases. The highest risk patient is obesity, and short, short neck, and small mouth, and small mandibular. So in such a case, so our usual anesthesia is not effective. It's dangerous. So we, instead of that, we use dextromethanometry. It's alpha 2 receptor, and it used to be used in the ICU. So it's very safe and stable.
I see.
And small advantage is bradycardia and hypertension. But this medicine is very so useful. So we are so depending on the cases, the risk and changes, the how to do the anesthesia.
For those cases, it seems that there could be some concern about the airway obstructions. Do, do you advise if they need to be intubated for the procedure, or could that be only the nasal tube that suffice?
Yes, as you know, propofol is very good medicine, but it has side effects of respiratory depression. The worst concern is respiratory arrest. So we have experienced. But important thing is check the changes of the patient's condition, vital sign. Oh, it stopped breathing. Okay, so lift the mandibular upwards and make it open the airway and put the airway. And then so strong ventilation mask, ventilation with 1% oxygen. Usually with this maneuver, everything is okay. But if very, very severe condition, so we haven't, but we are always prepared for the change to the general anesthesia with intubation.
Uh, and to my understanding, for the oocyte pickup, it is very unique procedures. Most of the time, it could be done and finished in less than 10 minutes. And well, you have been practicing like 5,000 cycles a year, so it means that you need to get a very high turnover. I mean, you need to do it and then discharge the patients in a brief period of time. Is there any special precaution in this group of patients, or is there any special care that we need to provide to these patients who will be like quick in and quick out?
Okay, that's very important things. So 2 days before, so our center office so distributes the list of the patients, and many past history were described. So some we check. Oh, this patient is dangerous. This previous time they have a shock or something like that. So we prepare before the oocyte pickup. So check is very important. So we discuss with the nurses and other doctors. So what kind of the anesthesia do we prepare? Okay, it's okay. But if respiratory, the dysfunction, depression, it occurs. So please ask the doctor, second doctor, and assist, help him. So always, usually at the top of the patient head is one nurse, trained nurse, and the doctor is also pick up, and second nurse is help the doctor. But if something happened, so they ask me, okay? Always this graph is transferred to my room, and they call me. It's 30 second. I go to the operation room and I assist the help this so rescue this patient. So this system, I think it's very important. So 5,000, 6,000, usually always about, so optimal number is, I think it's a 10 or 12 eggs. But sometimes PCOS syndrome, so it's not a good thing. But we have ever collected 60 eggs, 60 eggs. So it took 1.5 hours,
Wow.
but it's not a good thing. But I would like to say, if I prepare everything, the patient's condition and the record and other staff, so specialized staff prepare, so it's okay. So that I would like to say to my message.
Yeah. And also, for our cases, sometimes patients could be at risk of ovarian hyperstimulation, especially for these patients. They may have extremely high estradiol level. Is there any things that we need to be particularly cautious in this group of patients?
Okay, this is very, very important. And this is the most important thing I like to spread in the word. Okay? PCOS is very popular. Maybe I think it's Asian people. So especially clinic, so many PCOS patients come together. So referral from the other clinic. And basically, my concept is PCOS is their own character. So we cannot change their genetical nature. So usually the long history of the PCOS history is try to decrease the number, okay? Or pick up in the immature stage like IVM. But I don't think so. Okay. I will try to develop they well. But as it's possible to try to decrease at most 30 eggs. So using the Lecobel or uh, other medicine to aromatase inhibitor something. And most important thing is how to prevent OHSS. Okay, OHSS, I would like to say 100% we can stop it using three kinds of letrozole, cabergoline, GnRH antagonist for 5 days after just oocyte pickup. Menstruation start from the 6th day from the oocyte pickup. So there is now no
Yes.
OHSS patient. So
That is
please follow this.
Yes, that is very true. I would say that hyperstimulation has been reducing significantly with the advent of GnRH agonist trigger. Okay, so now, well, as you are an anesthesiologist. At the same time, you are an IVF doctor as well. Do you think is there any negative effects on the anesthetic medication, on the quality of the eggs, on the quality of the embryos? The reason I ask because some doctors who are not doing the anesthesia could be because of the fear that the anesthetic medication could have some negative effects on the gametes.
Yes, it's a big problem. So there are many papers about this drugs has a significantly lower result, but all of them were based on the experiment with mouse. So mouse desert result doesn't apply to 100% to humans. So I think over 20 years, my experiences, one thing I have to pay attention is nitrous oxide. Okay, nitrous oxide has a analgesics effect, very effective and very easy to use. So just pull, it's okay. But to be careful, it has been proved that has diverse effects on oocyte. So we don't use this nitrous oxide. But other thing is fentanyl. Fentanyl is very good, strong, drug. But usually it's happened, respiratory arrest. So it's very pay attention. So usually, propofol is it's noted, it's a rapid onset and rapid recovery. So it means they have a very risky function. So always we check the PSO2 level and the CO2 level and the respiration. But if everything is prepared, don't worry about it. It's okay.
So now it is pretty much like the propofol are the preferred agents for these procedures. Okay,
Yes.
so now let me ask you one question. When talking about the anesthesia, I would say that one main role of yourself is that to make sure that patients do not have significant pain after the procedures. Okay, pain management could be something that is very important in order to keep patients in the treatment, because if the pain is unbearable, probably there will be a significant drop off, and we know that the drop off from treatment will compromise the cumulative pregnancy for the IVF. So do you have any special tips about what should be offered in terms of the management of the post procedures pain?
Yes, it's very important point. So we use the drug. So drug is not naturally inside our body. It's coming from outside. So we have to get rid of them as soon as possible. But most important thing is post-operation monitor. So monitor the pressure, respiration, vital signs, and awareness. And usually propofol, it's recovery very quick. So 30 and 60 minutes later, they return to almost normal. But we don't check. So please stand and step down, step up, and walking there, and everything is okay. So I admit the discharge. But one condition, please ask your daughter, husband, other person, healthy person, come together, accompany you. And driving is not is prohibited. So anyways, after operations, So monitoring is very important to save the patient. Okay.
All right. All right. Thank you so much. I think today it is very interesting to talk with you who had a very good experience in IVF, and at the same time, you also has a strong experience as an anesthesiologist as well. So I think it could reassure us and also for sure to reassure our patients on the safety of the anesthesia for the oocyte pickup procedures. Okay. And before we finish today, do you have any things to talk to the audience? Any
Okay.
last message?
Thank you very much. So give me some minutes. So I like give the audience my taking home message. Okay. So
Yes.
five at oocyte pickup collection. So with these combination of anesthesia and sedatives, patients feel no pain and no side effect and no after effect. But it's if it's procedure performed in the operation room with medical technology and with specialized staff. So specialized staff is very important. And second is now we are doing anesthesia doesn't affect oocyte quality and clinical outcome. Don't worry about it. And third, the more you correct the oocyte, the higher the success clinical outcome became higher. And finally, so the monitoring before and after the operation also pickup is very important. So I think it's maintained to this established method. I do my best as long as I can. Thank you very much.
All right. Thank you so much. So today I think we have learned a lot from you. Okay, to make sure that anesthesia is safe and it is not reasonable to compromise patients' IVF success for the too small number of oocyte to be stimulated due to the fear of anesthesia. I hope that our podcast today would be beneficial to many of us. Thank you so much, Professor Tanaka.
Thank you. Thank you.
I hope you enjoyed today's episode. Make sure to hit that subscribe button so that you don't ever miss any episode. Let's embark on a mission to enlighten, empower, and engage. This is Aspire's Ed Talk, where learning has no boundaries.